The main thing we were looking for from this category was people who could show that they'd measurably improved safety for patients. The first finalist that we went to see was the Welsh Ambulance Trust, who had done some amazing work with the deaf and hard of hearing community. The main thing that they put in their proposal was a medical information card that they'd developed so that people who would find it difficult to communicate could feel confident that they were safe in an emergency. So that single intervention had been taken up really well by the people who live in the area. And I think that wasn't just because it was a great idea, it's because they developed a really good relationship over many years, so that there was a really strong connection between people who were deaf and hard of hearing and the people who run services locally. The second project that we went to see was at Cardiff Health Board, where I think they'd started from the position that if you were really going to transform the safety and experience of people using health services, then you couldn't just address individual issues in single organisations. You needed to look across the whole pathway and across all the organisations that provide services to people. So they'd done a really impressive range of projects. They'd done work on length of stay, their emergency pathway, the community hospitals, the ambulance service was working very proactively with acute providers, and the whole thing added up to a community where people were thinking first, how could you improve safety from a whole system perspective? The final team that we went to visit was the team from Cardiff and Vale University Health Board, a really great group of clinicians who over many years had introduced a new approach to exercise testing as part of preoperative assessment for people undergoing major abdominal surgery. So they'd been able to show that this was much more effective than clinical judgment alone at being able to assess the risk for patients who are going into major surgery. That had a significant difference in terms of being able to discuss risks properly with people who are using the service. It makes a difference in terms of making sure critical care capacity is available appropriately, and obviously sometimes it can make a difference in terms of whether to proceed with surgery or not. I think other organisations can learn a lot from these projects. So firstly, they could take inspiration from the wide range of ways in which you can improve safety. Secondly, what I think we're seeing is that to be successful, you need to make sure that you're really understanding the problem that you need to address and that you've got data to be able to back that up. This was a really high quality field. We saw some really great awards, so everyone who reached the shortlist did a fantastic job. I'd like to then encourage people to take it to the next stage. Think about how you're going to develop your ideas further and how you're going to promote what you've learned to other people locally and more widely.